Hi, this is Eric Hansen here with the Susan G. Komen organization. Today I'm here with Sadhna Kohli, research scientist and Ph.D. at Mayo Clinic in Rochester. How are you today, Sadhna?
I'm fine, thank you. How are you?
Good. Why don't we start just by you telling us a little bit about yourself?
Great. I moved here to the Mayo Clinic about 18 months ago from the University of Rochester in New York. I have a Ph.D. in pharmacology and a master's in public health from the University of Rochester in New York. My research interest is looking at the side effects of cancer treatment in breast cancer survivors.
Okay. The reason we are talking today is because Mayo Clinic, being one of the larger grantees of the Susan G. Komen organization, you're doing some interesting research in that space. Can you talk a little bit about your current research project?
Yes, sure. We usually associate side effects of cancer treatment like nausea, vomiting and hair loss being the more typical ones. But there's another one. In the cancer community it's known as chemo brain, where breast cancer survivors, I say breast cancer because that's where a lot of research has been done on, complain of changes in their memory and concentration when they are undergoing treatment for cancer. So my research is actually trying to find out what is going on with these women. So I have been funded by the Komen, where I am looking at cognitive changes. We will test patients before their treatment, 4 to 8 weeks after treatment, and again a year follow-up. And the tests that we are giving these patients are a battery of neuropsychological evaluations, which are going to be coupled with brain imaging. A lot of women complain of these cognitive changes, but when we test them, they usually test in the normal range. So we think it's because they are, already functioning at a higher level. So when we give them a standardized test, they score normally. So coupling that with the brain imaging, we can see what's going on in the brain. We will measure 3 brain metabolites that we know are associated with cognitive dysfunction and associate those with these neuropsychological tests.
Okay, so I know you're about halfway through at least the first cycle of this research this year. Once you get through a full cycle this fall, how do you plan, or at least tentatively plan, to apply some of the research that you've learned to how you can help improve the patient experience going forward?
Well, there are quite a few things we can do to help these women once we know that they have been documented with cognitive problems. One of them is exercise. There is an abundance of literature out there that women who exercise improve their cognitive skills tremendously. Meditation and yoga are included in this. Just sitting down, forgetting everything that's going on, and focusing helps with those concentration skills. Also, there are some pharmacological interventions, psychostimulants such as modafinil and Ritalin, but a lot of research still needs to be done to find out if they are helpful, but there are some small studies to say that there is potential in those psychostimulants. There are also behavioural interventions where patients can sit and meet with psychologists and go through some therapy. But first of all, before we get to this, we definitely need to know who is suffering from chemo brain and who will benefit from these interventions.
Okay, great. Thank you for your time, Sadhna, and we look forward to seeing some of the results of your research going forward.
Thank you so much.